Hello everyone, my name is Katie Galligan, and today my presentation will be over an emergency care violation. I will start with the presentation overview. To begin, I will be discussing what the EMTALA is. Then I will be giving a summary of Shelley Nelson's story and how it relates to this medical act. And then I will discuss how EMTALA adds value to the healthcare system, as well as my personal beliefs on it and how reading this article and learning more about it helps me better understand this course. And then finally, I will get to my sources. So to begin, what is EMTALA? EMTALA stands for the Emergency Medical Treatment and Labor Act. What this act entails is it is a law that prevents hospitals from refusing or limiting treatment to patients regarding their condition or financial status. So this law is specific for hospitals that have emergency rooms. It is also known as the anti-dumping law. So basically hospitals cannot dump patients. So this really comes into play when a patient comes in emergent condition, and regardless of what that condition may be or what their financial status is, if they are able to pay up front or not for care, they are still receiving care. They are receiving tests and labs ran if that is need be, and also being treated, whether that be medication or something else, until they are in stable condition to leave, like I said before, regardless of their financial status at the time. So, how this comes into this presentation. So, this article on the iowadispatch.com discusses how Trinity Regional Medical Center in Fort Dodge, Iowa was facing a lawsuit for mistakes that led to the death of a woman in their emergency care. There were claims made that there were violations pertaining to EMTALA regarding the discharging of this patient before she was in stable condition that later on resulted in her death. And then according to this article, this was not the first report of a violation of the Emergency Medical Treatment and Labor Act. There was also two others in previous years that were not related to this specific incident. So this is the story of Shelley Nelson and why this lawsuit came to be. To begin, Shelley Nelson is a woman who the lawsuit was centered around. She arrived at the emergency room on August 29th of 2022 around 6 o'clock a.m. Here, she complained of abdominal pain and also nausea. This resulted in her getting some medication as well as a CT scan due to some other conditions that she had had in the past, with the overall diagnosis being constipation. She was then discharged despite her poor condition. The article talks about how she was barely able to move, walk on her own, or get into the car by herself. So the hospital is releasing her even though she is not in stable condition. She then goes back to the emergency room around 3 p.m. that afternoon. Between 3 and 4 o'clock, there were some labs and tests ran, and the reports concluded she was showing signs of septic shock as well as sepsis. So, again, this is her second time in the emergency room. She has already been there once and discharged, even though she wasn't stable, comes back, gets these reports. Over the next couple of hours, her heart rate dramatically dropped. She was also becoming non-responsive and passed away 3 hours later at around 7:30 p.m. This resulted in the lawsuit being filed. In this lawsuit, it says that the EMTALA Act was violated because she was released from the emergency care in non-stable condition. So this brings on what values EMTALA has for the healthcare system. So, to begin, protection of patients, of public health, and medical professionals as well. To start with patients, people come to the emergency room because they are in need of emergent care. This act protects them to receive that care, regardless if they are financially able to do this or not. This also protects public health because if you protect one person, whether that be from sickness, something that could spread, it then contributes to the overall public health of the community. So this act also protects that. And then finally, it protects medical professionals. They are there to do their job professionally and to do it well, and this ensures that they do. And then they are covered and they are not facing lawsuits like the one here. And then the second part of EMTALA is equality. It allows for equal access to healthcare. Excuse me. And avoids financial burdens on individuals. Personally, when I was reading this article and learning more about this act, I just thought that it really shows how important and critical care is to people. And I think that this act is critical in allowing for patients to receive that care. So it really helped me, again, show how important this act was and how much of an impact it could really have in everyday emergent situations. And then finally, to end my presentation, these are the sources that I used. Thank you.